This morning on today's checklist, we're going to break down the popular trend of intermittent fasting, from how it works to the effects it can have. Here with more, our dynamic duo, NBC News medical contributor Dr. Natalie Azar and Today nutrition and health expert Joy Bauer. So good morning to you guys. We've heard so much about intermittent fasting or internet fasting. What is it and how is this supposed to work?
So I think when most people think about intermittent fasting or they think about diets in general, you think about what you can and can't eat. Intermittent fasting is about when you're eating. Sometimes we refer to it as time-restricted eating. There are certain hours in the day that you eat and certain hours in the day that you're fasting. And the research is pretty encouraging in terms of what potential benefits it could have. These include, it could be positively affect your blood sugar, your fasting insulin levels, your lipids, your blood pressure, chronic inflammation. It can improve your HDL, which is the good cholesterol, and improve your fat-free mass. These are the things that we refer to as things that will improve your metabolic health. And experts say that this happens when you start to fast between 12 and 14 hours. That's kind of the sweet spot. And that you don't want to eat 3 hours before bedtime. That's when what we refer to as the metabolic switch, where you're potentially burning fat after you're exhausted all of your sugar sources. In terms of weight and improving waist circumference, I think one of the biggest misconceptions about intermittent fasting is that it automatically equals weight loss. That's not necessarily true. It's really about calories. So let's say you're eating during an 8-hour window and you're fasting the rest of the time, but that 8 hours you're not going to lose weight. But it really is sort of the inherent, caloric restriction that goes along with the structured eating that really can result in weight loss.
Joy, I know there are a lot of different intermittent fasting methods, right? What are a few of those?
Yeah, so I would say the most popular method is something called 16-8. Imagine there are 24 hours in the day. 16-8 refers to you are fasting for 16 hours and then you have an 8-hour window for eating. This is really tough. So it would be something like you would push off breakfast or the first meal of the day till noon, and then you would close the kitchen by 8 p.m. That would be your 8 hours. I have to say with this method, a lot of people wiggle it around and they loosen it up a bit. So it could be 14-10, or what I actually like is 12-12. If you start breakfast at 8 o'clock in the morning, you close the kitchen by 8 p.m. It just feels more sustainable. 5-10 means that you eat normal 5 days during the week.
5-2, you mean?
Yes, 5-2. Okay. You eat normally 5 days of the week, and then 2 non-consecutive days, you either totally fast or you drop your calories down super low between 500 and 600, 500 to 600. And alternate day fasting is exactly that. One day you're eating normally, the other day you're fasting. You're eating normally, you're fasting.
Okay, so Dr. Azar, like anything people might want to try for the first time, what risks or other factors do people need to consider before going down this path?
Yeah, so first and foremost, I think for most people who are otherwise completely healthy and have no medical issues, could they start to do this without consulting a doctor? Possibly. But most of us would say that if you're interested in doing something like this, talk to your healthcare provider about it, because you may have some conditions that would make this potentially not the right thing for you. It takes about 2 to 4 weeks for your intermittent fasting to sort of settle into your system. In the beginning, you may feel tired, you may feel dizzy. It can certainly affect diabetes management. If you're a type 2 diabetic, you may need to adjust your medication. Headaches, mood swings, constipation. It may even affect your menstrual cycle. And there are certain people who should not really engage in intermittent fasting. Those people include those with a past history of an eating disorder. If you're pregnant or breastfeeding, maybe you're at high risk for falls or bone loss if you lose weight rapidly. If you're a type 1 diabetic, maybe you need medications you take medications that require that you take them with food. And adolescents, kids under the age of 18, it's not advised.
So Joy, are there any tips as to what kind of foods, what kind of drinking you should be doing?
Definitely. So because you have shorter windows for eating, you want to make sure that your food is nutrient dense, like we're showering our body with all of the right stuff. You want foods that are balanced, that are filling, and that are slow digesting so that you could help curb your hunger. So a combination of quality protein like poultry and fish and tofu and lentils, definitely high fiber carbs, vegetables, fruits, whole grains, and healthy fats, nuts, seeds, avocado, olive oils. And when it comes to the fasting part, there's no calories that can be introduced. So you want to think when it comes to staying hydrated, which is super important to keep your energy up and again, to tame your hunger, water, flat or sparkling. Black coffee, so no creamers, no milk, no sugar, and then also tea, but as long as it's unsweetened, green, herbal.
Yeah, Craig wanted to know, so bourbon straight.
Yeah.
Okay, so that would be during your eating window.
That's the 5, not the 2.
Exactly.
Thank you.
Dr. Nat, Joy, thanks so much.
You're welcome.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.